Well, July is Dry Eye Awareness Month. Now, dry eye happens when your tears don't provide enough lubrication for your eyes. Then it can be a real problem. We're joined now by Dr. Amanda Salters from Shanbom Eye Specialist in Berkeley. Doctor, thank you so much for joining us this morning.
Thank you for having me.
So let's jump in. I mean, what are the symptoms of dry eye that we should be on the lookout for?
So there are many symptoms. Some of the most common symptoms are going to be just a dry, irritated, tired feeling eyes, burning eyes, itching, a gritty, sandy sensation where you feel like there's something in your eye. And believe it or not, tearing or watery eyes is a very common symptom of dryness. And also often on blurring of your vision, particularly with blinking or when you've done some prolonged screen time or reading, you may notice some blurring of your vision.
Now, outside of screen time, what are some of the things that can lead to dry eye? I mean, we know that we've been staring at devices so much for the past year and a half. What are some of the other factors, though, that can cause this?
Absolutely. So there are a lot of lifestyle issues that are leading to dry eye. And one of the things during the pandemic is something called mask-associated dry eye. So if you're not wearing a properly fitted mask with the nose wire and, tight around your face, the air can be directed right into your eyes. That's one thing. Also, certain cosmetics like using waterproof makeup or drawing on your waterline, the inner part of the eyelid margin, having your air conditioning or fans blow directly in your eyes. These are just some simple lifestyle things that have more of an effect than you think.
All right. And, so what can we do? Do we need intervention, or will dry eye just go away on its own?
Great question. For some people with very mild disease, these lifestyle modifications, for example, just switching to a non-waterproof makeup or making sure that you don't have those fans blowing directly on you, adding a humidifier at night, sometimes that's enough for people. But for many people, that's not going to be enough. And, one of the most accessible treatments you can try on your own to see if it works before consulting a doctor is the over-the-counter lubricating artificial tear drops.
All right. And, you go to your pharmacy and it seems like there's a wall of artificial teardrops and lubricants. How do you choose the best one? What should we be looking for?
That's right. You go and there is a wall, and it can be intimidating. So a couple of things. I would say, number one, you want to avoid anything that takes the red out. You want to be treating what's causing your redness rather than the redness itself. So you want to look for something that just says artificial tears or lubricant eye drops. I prefer preservative-free because the preservatives can be irritating to some patients' eyes. And my feeling is that any brand is an okay thing to start with. The store brand is fine as well. I would say the one thing you want to make sure of is it should feel good when you put it in. It should not burn or sting, and it should be soothing and cooling and refreshing. So if you try a brand and you find that it makes your eyes burn or feel sticky, you want to try a different brand.
Now, if people have tried this, they've tried the artificial tears, still not working, how can they get a hold of you guys? Because they actually may need some professional help at that point, correct?
Absolutely. I think if you've tried some things like lifestyle modification and lubricating drops and that's not enough, that's the time to visit your doctor. What we do is, you obviously call our office for an appointment, but what we do is we want to see what are the contributing factors that we can help you modify, and also what type of dry eye do you have so we can guide your treatment and see whether or not you need a procedure or a prescription eye drop.
All right, Dr. Amanda Salter from Shanbom Eye Institute in Berkeley. Thank you so much for joining us this morning. Really do appreciate your time and your insight.
Thank you for having me.